Today we are going to talk about hyperparathyroidism. It's a very important topic and a college favorite. But first, a bit about parathyroid hormone. Parathyroid hormone is secreted from the parathyroid glands, which increases the calcium levels on the blood and decreases the phosphate level by acting on kidneys, bone, and the gastrointestinal tract. On kidneys, it increases the reabsorption of calcium. In bone, it increases the resorption of calcium, and in gastrointestinal tract, it increases the absorption of calcium. The types of hyperparathyroidism, it is of course three types: primary, secondary, and tertiary. The causes of primary hyperparathyroidism are solitary adenoma, I should say, parathyroid hyperplasia, multiple adenomas, or carcinomas. The secondary hyperparathyroidism is due to chronic renal failure, and tertiary hyperparathyroidism occurs when there is long-term stimulation of the parathyroid gland, which is caused by chronic renal failure, and the parathyroid gland becomes autonomous. So here is the common biochemical abnormality that you're usually going to see in the questions that comes up in the Part A exam. You're going to be given many levels, but the actual thing that you have to look for is the calcium, the phosphate, and a few associations. So first of all, the primary hyperparathyroidism, the calcium level will increase, the phosphate level will decrease, and in the question there might be a few suggestions, maybe a few symptoms suggesting Men's syndrome, or few non-specific symptoms such as bone weakness, muscle aches, joint pain, or abdominal pain. And the common mnemonic for primary hyperparathyroidism is stones, moans, abdominal groans, psychic moans. So these may be present in the question. In secondary hyperparathyroidism, the calcium level is decreased, the phosphate level is increased, and there may be a history of renal failure. In tertiary hyperparathyroidism, the calcium levels may be normal or slightly increased, the phosphate level may be normal or slightly decreased, and it may be associated with a history of renal failure. Now, how will you differentiate when it comes to primary and tertiary, because the biochemical abnormalities are quite similar? You have to look for the associations. Like in the question, there may be a history of renal failure, but in primary there is no usual history of renal failure or some such. Okay, so let's solve a few questions now. A 72-year-old woman. Now these parts you have to overlook. Sometimes there are a few demographics and a few sentences that are usually offset, so you should look for the key points. Back pain, chronic renal failure. Now when you see chronic renal failure, you think that okay, it may be one of two of the hyperparathyroidisms. It may be secondary or it may be tertiary. It's not primary, right? So even before I show you the options, it may be secondary or it may be tertiary. So here is the biochemical report. The calcium level you can see is decreased, and the phosphate level is decreased also, but the parathyroid hormone level is increased. So it is secondary hyperparathyroidism. Now this is unusual. It's the phosphate level is actually normal. It may be increased also, but the principal abnormality here is the calcium level. The calcium level here is decreased, so it is a secondary hyperparathyroidism. Here is another question. A 60-year-old man, 2 weeks post-renal transplant. So it is a history of chronic renal failure, right? So it may be again of two things. It may be secondary or it may be tertiary hyperparathyroidism. So here we see the calcium level is normal and the phosphate level is decreased. So it is most likely tertiary hyperparathyroidism. Now here's the final question. A 25-year-old woman, blah blah blah, on inquiry, she has been feeling depressed for several months with vague abdominal pain in her upper extremities. Now these are the two important points. You don't really have to look at these either to know the answer of the question. The answer is parathyroid adenoma here, because it is the cause of primary hyperparathyroidism. That's it for today. Thanks for watching.